Hamilton families with children needing specialized care fear for their kids' quality of life once they age out of the pediatric system. Today they met with the Hamilton MPP to address their concerns about the transition. Jason Gaidola joins us now with more. Jason.
Yeah, that's right, Taz. Children's hospitals like McKids offer complex care for children up to the age of 18. However, families today tell me that the transition phase out of the pediatric system starts at 16 years old, meaning that they'll have to look for other physicians at other care facilities, mainly adult hospitals. I spoke to one mother who we did speak to recently, and she tells me that yesterday her daughter had an unfortunate close call under these circumstances and is seeking better solutions immediately.
She was having belly issues, so they did a CAT scan, and when they gave her the sedative to put her to sleep, she coded blue twice on the table, and they were able to revive her.
After speaking with CHCH News last week about her daughter Keisha's healthcare needs, Tammy Embrey says her 18-year-old went into respiratory arrest yesterday morning at Juravinski Hospital.
Thankfully, they were able to save her life, but this has brought up a big concern to them now. This is not the situation they want to be in either.
Embrey says Keisha has numerous disabilities. While being administered medication, she says her body failed to handle the dosage given to her. She says since leaving McMaster Children's Hospital in April due to her age, transitioning to doctors in the adult system is becoming difficult. Hamilton Health Sciences tells CHCH News it cannot speak on individual patients, but its staff work with families. Adding in part, our teams work in partnership with patients and families to appropriately and safely support their care needs. This includes transition from pediatric to adult services. Joining her are other families who have concerns and want quicker, specialized care for their children. Leslie Subner says her 16-year-old son, Callum, is living with a rare and severe neuromuscular condition and requires a breathing tube.
I mean, my doctor was great. She said, sure, but she said, I'm going to be relying on you as a mom who knows your son to help us with that.
Back in April, the province launched its pilot program where it's sinking in nearly $100 million to help support children with complex care needs. The program will run across 3 children's hospitals in Ontario, including McKids here in Hamilton.
We know that the government will just go ahead and with the stroke of a pen create a new program, but that doesn't necessarily mean it works for families. Making sure we do consultation and understanding the process and what families are facing, what we're trying to correct.
Hamilton Mountain MPP Monique Taylor says she's calling on the Ford government and the health sector to task a team of medical professionals to help shift each family to the right doctors when leaving the pediatric sector.
There has to be a proper transition team. What that looks like at this point, I'm not really sure, but that's something that we'll get to. But it will be with the help of doctors, right? With the help of McMaster, with the help of sick kids.
We did reach out to the health minister's office and the ministry asking if they have any plans to help families transition their children into the adult care system, and we have yet to hear back. Taz?